It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. How often do puppies poop? You just took your puppy for a walk and he had several large bowel movements, but now your puppy is squatting to defecate again. Sometimes it may feel like your puppy is made of poop. But is this normal? Do puppies really poop more than adult dogs, and why? Here are the answers to everything you wanted to know about how often puppies should poop. 1. How often should a puppy poop? In general, puppies defecate a lot. They are small, with an intestinal tract that is still developing. Food is processed very quickly and sometimes is not digested as completely as it could be. In general, the younger the dog, the faster the food will move through its digestive tract. It is not uncommon for a puppy to defecate 5 to 6 times a day. Some even more. The rate of defecation will decrease as the dog matures. Although a 2-week-old puppy may defecate at every meal, at 12 weeks he may only defecate 4 times a day. At 6 months, it can be 3 times a day. Usually, by 1 year of age, they will have adapted to their normal habits. An adult dog usually poops once a day, but could poop up to 3 times a day. As your puppy's pooping schedule calms down, you'll begin to see what is considered normal for him. Any changes to your puppy's defecation routine should be gradual, so if you notice any sudden changes, call your vet. Pay attention to the frequency, as well as the consistency, color, texture, and any coating. Also take note of anything that doesn't belong in the feces, such as worm fragments. They may look like spaghetti or grains of rice, or any pieces of toys or other things your pup has eaten. 2. What happens if you poop a lot more than average? It can be difficult to compare puppies as there is a wide range of what is considered average. Some puppies will poop more frequently and others less frequently. The most important thing to pay attention to is what is normal for your pup. If you suddenly notice that your puppy is pooping more than usual, look for any changes in color, consistency, and pay attention to how your puppy behaves. Look for signs of discomfort and monitor your puppy for 24 hours. If stool changes persist, or he is not eating, active and cheerful, it is time to call the vet. Almost all puppies are also born with intestinal parasites. This is one of the reasons why veterinarians recommend deworming them and testing stool samples frequently when they are young. Parasites can affect your puppy's stool, so it is best to have them diagnosed and treated by your veterinarian. 3. What happens if your puppy doesn't poop enough? This is rare in a healthy puppy. If he suddenly starts producing less poop or straining less, he may have eaten something that is causing an intestinal blockage. A possible intestinal obstruction is an emergency situation. Anything your puppy chews, such as pieces of a toy, can cause an intestinal blockage. Puppies who are not feeling well or eating normally will also produce less stool than a normal, active puppy. 4. When should a puppy poop? Most puppies need to defecate shortly after eating, but this can vary. It takes time for them to understand when their body is telling them they need to go outside, so training your puppy to go outside may take some time. After feeding, wait a few minutes and then outside. Staying outside with your puppy until he has pooped will reduce the chance of him coming back inside and pooping right away. Look for signs that your puppy needs to do this, such as looking around and starting to sniff the floor. They may begin to spin around and adopt postures as if they are about to. As soon as you notice signs that the puppy is getting ready to go outside, take him outside quickly to assist in training. 5. What should your puppy's poop be like? As a general rule, puppy stools should resemble a large, soft muffin. It should be brown and well-formed, not soft, runny, or too hard. The size of the stool will vary depending on the size of the dog, the time of day, and its diet, but pay attention to especially large or small stools. A small amount of mucus covering the stool is normal, but it should not be tinged with blood. Finally, make sure there is no undigested foreign material in the poop. Before long, you'll have a clear idea of what is normal for your pup. If you notice something that doesn't seem right, contact your veterinarian. Puppies' bowel habits and bowel movements change over time, but those changes should be gradual. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.